The recovery after an abdominoplasty is usually about 6 weeks. Sometimes it can be a little less than that depending on the type of procedure that I do. The big thing is that people can't lift more than 10 pounds for 6 weeks after the surgery, especially if I repair a rectus diastasis. After the procedure, you wear an abdominal binder, so it's a tight wrap that goes around your abdomen. You wear it day and night for 6 weeks. The first few weeks after the operation, I tell people not to stand up completely straight, just to avoid putting any unnecessary tension on the surgical incision. And the same goes when you sleep at night. You don't stretch out, but you keep a little bend at the waist to keep the tension off of that so it heals up a little bit nicer. In the first days and weeks after the procedures, the kind of things that you can expect would be a little bit of bleeding or drainage from the incisions. That usually occurs for about the first 24 to 72 hours after the operation. You can have some nausea after the surgery, and again, this can last anywhere from 1 to 3 days after the procedure. There is some pain associated with the surgery, and you can take a combination of prescribed pain meds as well as over-the-counter medications to keep that under control. And I find that around 7 to 10 days, the pain is much improved and people are feeling pretty good. As far as returning to regular activities, it's going to take about 6 weeks before you can heavily exercise again. Some activities, like going for longer vigorous walks, are okay starting at about 4 weeks from the time of the surgery.